All right, today we're joined by Brian Fuller on the Ortho Perspective. Dr. Fuller completed his residency at Brooke Army Medical Center in San Antonio. He followed that up with a total joint fellowship at Rush in Chicago, and then he did the British Hip Society traveling fellowship. So, welcome, Dr. Fuller.
Oh, thanks for having me.
Absolutely. I know we tried this before, had some technical issues, but glad we could finally do this. Um,
Yeah.
I wanted to talk to you specifically about what I saw happening at AUKUS. I know I saw this, and a lot of people on LinkedIn saw this, is just what the whole LinkedIn platform and community has done within orthopedics. Um, so just starting, how long have you actually been active on LinkedIn?
Ooh, interesting. Active versus having a login are different, but I
Yeah.
would say I probably made my first post, I don't know, year and a half ago or something like that. Not a long time
Yeah.
ago, I don't
And
think.
probably before that, occasionally commenting and interacting with people, but not
Sure,
much. So
sure. Mostly
18,
interacting
yeah,
with financial planners or chat bots from
right. Or people with one connection that want to connect with you. Yeah. I think we're all familiar with those people. Um, but at AUKUS specifically, it was really interesting to me just how over the past few years, because I think your timeline is similar to a lot of people that have been using it. And I saw posts about surgeons, you included, getting together for dinner, you know, people that I assume maybe you had a conversation with them before, but really not much of a relationship out of interacting to start with. Is that correct?
No, it's absolutely true. It's made the world much smaller. People from Alabama or Chicago that I maybe had commented on something they or vice versa, and maybe we DM'd here and there, but I was able to sit down at kind of a happy hour with several people on LinkedIn and have really, I don't know, what I thought were thoughtful and interesting conversations about kind of the state of orthopedics throughout the country.
Yeah.
Honestly,
Well, it's interesting that you say that because I was going to ask the question, which I will now, about for years there's been industry sponsored dinners, happy hours, etc. How was this experience different from just going to one of those?
uh, I interesting. I guess there's anytime industry is involved, and industry is a necessary evil. I
Mhm.
think we both work with and sometimes for industry, depending on what we're doing. But normally, there's clearly a an angle or whatever's being pushed, specifically at AUKUS, whenever industry is involved. And when I sat down at the table with people much more prominent than me on LinkedIn, we were just talking about common problems we face or issues that we've had and unique solutions that we found to those, trying to figure out what protocols people are using or challenges we've run into. It was just really open and honest discussion from people from different backgrounds. I'm very fortunate to have trained at Rush, and it's provided me with a lot of connections. But our training is very similar, and so some of the problems and the way we handle things is very similar. And it's always eye-opening to talk with people from different backgrounds or different situations and get their take because it's unique and helpful, I think.
Yeah. And I would agree. I mean, it probably led itself to a more organic conversation with them rather than you were at such and such a company sponsored happy hour and you guys all chose to come together to meet with each other. And so I find that, you know, that is fascinating because I've seen the same thing on the rep side with, myself, Mike Nelligan, Kevin Brown, Brian Trolley. I could go on for a while naming these people. And the funny thing to me, or the interesting thing I should say, is that by our interaction on LinkedIn, once we met each other, it was almost like we knew each other for years and we were good friends. Did you find a similar thing?
Yeah. I mean, I think birds of a feather flock together, right? And so everybody I was sitting at the table with was a fellowship trained adult reconstruction surgeon, and so we're all nerds about joints and whatnot, and so I thought we all got along really well. They felt like we'd talked before or knew each other more than you would think, just sitting at a happy hour for sure.
Even though I'm assuming you guys all don't have the same philosophies.
Very different, several of us for sure.
Yeah.
Very different.
So how was that experience? I know on one hand we all have our own philosophy about things, but at the same time, intentionally getting together with people with different is the way to better ourselves, correct?
Yeah, I think so. Trying to be open-minded about different perspectives. Everybody wants to think that like the way I'm doing it, it's pretty good, it's working. Why would I do something different? But I think clearly there are nuances and different ways of doing things that may be as good and maybe better than the way you're currently doing it. Yeah, yeah. I don't know. Without being too specific, not that anything's trademarked or
Right.
proprietary, but like Andrew Wickline clearly has authored papers and discusses postoperative swelling and as it relates to knee replacement recovery. And he's got a vast experience with mechanically aligned, navigated, or robotic assisted knees. And he's since gone away from that. He's using kind of a medial pivot or ball and socket design and more kinematically aligned, in addition to some of the unique or cutting edge things he's doing with swelling, lymphedema wear, and tranexamic acid, and some of these things. And that's fascinating. Vendasa clearly is pushing the envelope as far as opioid sparing total knee replacement, even though Pacira recently got FDA approval for IPAC and adductor canal blocks. I think he was doing some of that before it was FDA, approved off label. In addition to cryoneurolysis preoperatively, he's sending patients home on Tylenol and an anti-inflammatory, and that's pretty unique. Dr. Barber is well seasoned with some of the newer robotic technologies that are coming out. I think he's one of few surgeons who's got to look at the Think T-Mini. And so it was interesting to hear him talk about his experience with that. Along those lines, he's a PS surgeon and clearly very different than I was trained or some of the other people at the table, but clearly does pretty well. There's a lot of people walking around with world champion belts doing pretty well after surgery. Yes. And then Herrick, amazingly, he actually does primary surgery, and it was interesting to get his take on the volume, and the breadth of the revisions that he sees in Alabama. And so, I don't know. It was great to sit around and talk to those guys.
Okay. Well, I'm assuming you told Dr. Siegel, anything you can't handle, just send to Dallas and I'll take care of it.
For sure. I gave him a voucher on American. I said, we're a hub. Just send it this way. Actually, I asked him the opposite. I was like, what is your catchment area? Anyway, what a gem.
Correct. I enjoy, obviously, I think the whole industry enjoys his posts, but that gets me around to, how do you use LinkedIn? I know that you are a watcher of Dr. Siegel's posts or other people's posts. I mean, what do you get out of that type of thing?
Yeah, it's always fascinating to see how people are handling these like very unique and challenging problems. Every patient is a little bit different, but there are kind of themes, I guess, with acetabular bone loss or heterotopic ossification or I don't know, in total knee bone loss with subsequent revisions, kind of what the prevailing thought or how he's seeing, because he's doing it day in and day out. For me, as a community orthopedic surgeon, not at a tertiary referral center, my biggest struggle is what can the system I operate in handle versus what I think I'm capable of handling. Clearly, anything that goes to Dr. Siegel's hospital, he has a team of people that are ready and available and capable of handling that. That's not necessarily true for me, and it's hard for me to admit that, but just because I can cut somebody's leg open doesn't mean that everybody around me is comfortable or capable of helping that patient after surgery. And so I don't know. I first started posting things that I would read that were new and interesting to me to try and get other people's thoughts. now I kind of follow what other people are doing, or new techniques or technology that they've tried. I don't know. If I read something on PubMed or whatever that I think is interesting, I might try and come up with a little anecdote and see if anybody else has seen something similar, or has any experience with it. I guess it's really just kind of crowdsourcing for me, even though it's not a huge crowd. It's trying to get opinions other than my co-fellows. They're great guys, and I appreciate and value their opinion, but 9 times out of 10, their opinion is similar to mine.
Right. And to what we talked a little bit about earlier, we need to intentionally go out of our sphere of influence that we're with regularly, because if you are around people long enough, there does tend to be a group think and limits the outside thoughts. But what's interesting to me is I remember you posted within the past couple of weeks about when you came to town shortly after fellowship, and this goes along, you revised an AML, and you came to the realization that your community hospital did not have everything that the big
Oh
house
yeah.
in Rush has just sitting there.
Oh
And
yeah.
so that's a great point for all younger surgeons, especially as they're out of their fellowship, is understand what your hospital can handle.
Yeah. Yeah. That one patient is responsible for a couple of the longest days I've ever had in the operating room, for sure. The 2 cases that I
Mhm.
mentioned in the post. And yeah, I don't know. AMLs aren't loose. That's the long story short. But it is important to recognize and understand. And they'll tell you in fellowship, like, things are going to be different when you get out on your own. Not everybody does 1,000 cases a year, and not everybody knows everything that's going on in the OR. You're the one responsible. But for most people going to fellowship, it's a straight line. They go to medical school, they go to residency, they go to fellowship, and then suddenly they're on their own. I got a small break there in the military where I was on my own for a few years.
Mhm.
But the first time the tourniquet goes up or you call timeout and you're the one responsible, it's different. I mean, you feel capable as a chief resident or in the end of fellowship, but it's just a little bit different when it's your credit card rather than the attending surgeon. And so, yeah, I don't
Yeah.
know where I was going with that, but long day for sure.
Correct. So kind of last question to wrap it up is how do you see using the LinkedIn platform, not social media in general, because as you and I did talk off air, um, LinkedIn for you is more professional peer-to-peer conversations, but how do you see it changing, maybe even after the dinner that you had at AUKUS, just getting to know that small group of surgeons?
Well, I hope that group grows. I think they'll be interested in meeting again, be it at AAOS or next year at AUKUS, and that will be great. I think the platform, just serendipitously, has been growing, specifically with
Mhm.
healthcare, and I think people like Vin and Alok, and some of these other people who are kind of like digital opinion leaders, Scott Sigman and the like. I think that's probably going to continue to grow. I don't know because I'm not in charge of industry or whatever, but I
Right.
think as social media influence increases, I think that will change the interaction online. It will be interesting to me. Right now, it seems pretty pure. People post things, anecdotes and whatnot, experience with technology, and there's not typically a lot of bias behind it. I'm really anxious to see in the next year or two how much that feels, for lack of a better word, tainted by
Mhm.
industry. I mean, I think guys should get paid for their opinion, and I hope
Right.
that they do interact with industry. I
Right.
just hope that we can keep it somehow relatively neutral or unbiased on the platform, because that's the beauty of it right now. Is I feel like people share opinions without the pressure that comes with industry sponsorship, I guess.
Yeah, and that I think that's a great point, because that is a beauty of it, is that it's a bunch of individuals giving their opinion. And the one thing that I'm encouraged by, where I think that might not be as big of an issue, is that I think if someone up there or someone's posting something and people are disagreeing with it, there's enough strong-minded, individualistic surgeons that are not afraid to say hashtag robots are for rookies or hashtag everybody should use a robot, etc. But I think that there's enough people out there that will call BS if they think it's BS.
I hope so. I still think people are more nice than kind on, somebody posted about that recently, but, you know, I, people don't necessarily, there's a few exceptions. There's some people who are aggressive about giving people honest, brutally honest
Right.
feedback and some not. But, yeah, I hope that continues. I really do. I think it's great for everybody involved.
Yeah, I completely agree. Well, it was great finally getting to meet you in Dallas a couple weeks ago. If there's anybody out there, surgeon, that would like to connect with you because they think similarly to you, what's the best way for them to do that?
Oh, I mean, certainly you can connect with me on LinkedIn. You don't have to send me a personal email or anything like that, but just make sure you don't have a stock photo of somebody that doesn't look like not you. That's an easy way to get a hold of me.
Yeah,
Yeah, I'm on there pretty regularly, and I'm happy to connect that way.
perfect. Well, I appreciate the time, Dr. Fuller, and we'll talk soon.
Yes, sir.